I'm Dr. Kewin, and for most of my career, I believed what many people still believe today. If a medication is prescribed by a doctor, it must be safe. That assumption feels logical, reassuring. Even patients trust their physicians, follow instructions carefully, and expect that doing so protects their health. But over time, something began to trouble me deeply. I started seeing the same patterns repeating in my operating room. Individuals in their 60s and 70s, people who were disciplined, responsible, and committed to their health, kept returning with serious cardiac events. They had followed every guideline, taken every pill as directed, and still found themselves facing heart attacks, strokes, or life-threatening complications. It forced me to look beyond individual cases and examine the broader system. What I discovered changed how I think about medication safety entirely, especially for older adults. As a cardiothoracic surgeon with more than 2 decades of experience, I have operated on countless hearts, many of which could have been protected with better awareness and information. My goal is not to alarm you but to inform you, because knowledge, when applied correctly, can be one of the most powerful tools for protecting your health. Many people are unaware that drug testing is often conducted on younger, healthier populations. These participants typically have fewer medical conditions and take fewer medications. Their bodies process drugs more efficiently, which means the results don't always translate well to older adults. By the time someone reaches their 60 seconds or 70 seconds, their body has changed significantly, and those changes can alter how medications behave. One of the most important changes involves how the body processes substances. The liver, which plays a key role in breaking down medications, becomes less efficient with age. The kidneys, responsible for filtering waste and excess substances from the bloodstream, also slow down. These shifts mean that drugs can stay in the body longer, sometimes building up to levels that increase the risk of side effects. A dose that is perfectly safe for a younger adult might be too much for an older individual. This difference is often overlooked, yet it plays a major role in many of the complications I see in my patients. Another factor that complicates matters is the number of medications many older adults take. It is not uncommon for someone over 65 to take multiple prescriptions daily, along with over-the-counter drugs and supplements. Each medication may be justified on its own, prescribed for a specific condition such as high blood pressure, diabetes, or chronic pain. However, these medications are rarely tested together in combinations that reflect real-life use. This creates a situation where interactions can occur, sometimes in unpredictable and dangerous ways. The body becomes a complex system of chemical reactions, and even small changes can have significant consequences. I want to emphasize that this is not about blaming doctors. Physicians work within a system that often prioritizes treating individual conditions rather than evaluating the full picture. The gap between what is prescribed and what is truly safe for a specific individual is where many problems arise. That gap becomes more pronounced with age, as the body's resilience decreases and its sensitivity to medications increases. Understanding this gap is essential for anyone who wants to take a more active role in their health. Let's begin by discussing one of the most commonly used categories of medication, pain relievers known as nonsteroidal anti-inflammatory drugs or NSAIDs. These include medications that many people use regularly without much thought. They are widely available and often considered harmless because they do not require a prescription. However, frequent use of these drugs can have serious effects on the cardiovascular system, particularly in older adults. When taken regularly, these medications can cause the body to retain sodium and water. This retention leads to an increase in blood pressure, which places additional strain on the heart. For someone whose cardiovascular system is already under stress due to age or existing conditions, this added pressure can be significant over time. It can contribute to the development of heart disease or worsen existing issues. This is not a rare occurrence. It is something I have seen repeatedly in my practice. In addition to raising blood pressure, these medications can also affect the lining of blood vessels. They may make platelets more likely to stick together, increasing the risk of clot formation. A clot in the heart can lead to a heart attack, while a clot in the brain can cause a stroke. These are serious outcomes that can occur without much warning. Many patients are surprised to learn that a medication they considered routine could play a role in such events. Pain management is important, and no one should be left to suffer unnecessarily. However, there are safer approaches that can be explored. Alternatives such as different medications, physical therapy, and lifestyle adjustments can often provide relief without the same level of risk. The key is to have an open conversation with a healthcare provider and explore options that are appropriate for your specific situation. Now let's turn to another category: certain older medications used to manage diabetes. These drugs work by stimulating the pancreas to produce more insulin. While this can help lower blood sugar, it does not always do so in a controlled manner. As a result, blood sugar levels can sometimes drop to low, a condition known as hypoglycemia. In younger individuals, hypoglycemia is usually noticeable and manageable. Symptoms like shakiness or dizziness serve as warnings, prompting the person to eat something and restore balance. In older adults, however, these warning signs can be less obvious or even absent. This makes hypoglycemia more dangerous because it can occur without the individual realizing it. Low blood sugar can have a direct impact on the heart. It can trigger irregular heart rhythms, which in turn can lead to more serious complications. For someone with an already vulnerable cardiovascular system, this can be particularly risky. It is important for patients and caregivers to be aware of this possibility and to monitor blood sugar levels carefully. Modern medicine has introduced newer treatments for diabetes that may offer additional benefits, including improved cardiovascular outcomes. Discussing these options with a healthcare provider can be an important step toward reducing risk while maintaining effective control of blood sugar levels. Staying informed about available treatments allows patients to make better decisions in collaboration with their doctors. Mental health is another area where medication plays a critical role, and it deserves careful consideration. Certain older antidepressants can affect the electrical activity of the heart. While they may be effective for treating depression or other conditions, they can also influence heart rhythm in ways that become more significant. With age, the heart relies on a precise electrical system to maintain a steady rhythm. When this system is disrupted, it can lead to irregular heartbeats. In some cases, these irregularities can become dangerous, especially if they go undetected. Regular monitoring, such as simple heart tests, can help identify potential issues early and allow for adjustments if needed. Sleep and allergy medications are another category that often goes overlooked. Some commonly used options can have unintended effects on the heart, particularly when combined with other medications. These interactions can increase the likelihood of irregular heart rhythms or other complications. It is important to review all medications, including those purchased without a prescription, to ensure they are safe to use together. Cold and flu remedies can also pose risks, especially for individuals with high blood pressure or heart disease. Some ingredients work by narrowing blood vessels to reduce congestion. While this can relieve symptoms, it can also raise blood pressure and place additional strain on the heart. Being aware of these effects can help individuals choose safer alternatives when managing common illnesses. One of the most important concepts to understand is polypharmacy, which refers to the use of multiple medications at the same time. Each medication may be appropriate on its own, but when combined, they can create complex interactions. These interactions can amplify risks and lead to unexpected outcomes. This is a common issue among older adults and one that requires careful management. To reduce these risks, it is essential to maintain a complete and up-to-date list of all medications being taken. This includes prescriptions, over-the-counter drugs, and supplements. Having this information readily available allows healthcare providers to review it and identify any potential concerns. It also empowers patients to take a more active role in their care. Another important step is to request a medication review. Pharmacists and doctors can evaluate the entire list of medications and look for interactions or unnecessary prescriptions. This process can lead to adjustments that improve safety and reduce the likelihood of complications. It is a simple yet effective way to enhance overall health management. Communication is key. Patients should feel comfortable discussing their medications with their healthcare providers and asking questions about their necessity and safety. A collaborative approach ensures that decisions are made with a full understanding of the risks and benefits. This partnership between patient and provider is essential for achieving the best outcomes. It is also important to avoid making changes to medications without professional guidance. Stopping or altering a medication abruptly can lead to unintended consequences. Any adjustments should be made under the supervision of a qualified healthcare provider who understands the individual's medical history and current condition. Throughout my career, I have seen the impact that informed decisions can have on patient outcomes. Many of the emergencies I encounter could have been prevented with better awareness and proactive management. This realization has driven me to share what I have learned in the hope that it can help others avoid similar situations. Your heart works continuously, supporting every aspect of your life. Taking steps to protect it is one of the most valuable investments you can make in your health. By staying informed, asking questions, and working closely with your healthcare team, you can reduce risks and make choices that support long-term well-being. Before you finish reading, take a moment to write down every medication you are currently taking. This simple action can provide clarity and serve as a foundation for meaningful conversations with your healthcare provider. It is a small step that can lead to significant improvements in your health. Finally, remember that the information shared here is general and not a substitute for personalized medical advice. Every individual is unique, and decisions about medications should always be made in consultation with a qualified professional. Your health deserves careful consideration, and the right guidance can make all the difference.